What if the first sign of declining strength is not visible in a mirror? It may appear when you need both hands to rise from a chair, pause halfway up the stairs, or feel less confident carrying groceries. After age 60, these changes deserve attention. But food alone is not an instant cure. Today you will discover 6 practical foods that can support your leg muscles. You will also learn how to use them, why movement matters, and which warning signs should never be dismissed as normal aging. Stay until the end, because the final action plan explains how to combine these foods with the activity muscles need in order to become stronger. Welcome to Dr. Maxwell Orvane, where we make health information clear, practical, and easy to understand. Before we discuss the 6 foods, let us correct an important idea. Your legs do not necessarily weaken before every other part of your body. However, weakness often becomes noticeable in the legs because they contain some of your largest muscles and perform demanding jobs every day. Your thighs and hips help you stand up, climb stairs, maintain balance, and control your body when you sit down. Even a relatively small loss of strength can become noticeable during these ordinary movements. Think about the last time you rose from a low chair. Did you push down with both hands? Did you rock your body forward several times? Did your knees feel as though they could not generate enough force? One difficult attempt does not prove that you have muscle loss. Chair height, joint pain, fatigue, medication, illness, and poor sleep can all affect your performance. But a repeated decline is worth noticing. Age-related loss of muscle mass and strength is often called sarcopenia. It can be affected by aging, inactivity, illness, inadequate nutrition, and long periods of bed rest. Here is an important myth versus fact moment. The myth is that feeling weak after 60 means you simply need to accept it. The fact is that aging affects muscle, but appropriate physical activity and nutrition can help preserve strength and function. Strength training can help counter age-related losses in muscle and physical ability. Nutrition provides the raw materials. Exercise gives your muscles a reason to use those materials. You need both sides of that equation. The first food is eggs. Eggs provide high-quality protein in a small and convenient package. Protein supplies amino acids, which your body uses to repair and maintain muscle tissue. That does not mean eating an egg sends protein directly into your thighs. Your digestive system first breaks the protein into amino acids. These amino acids enter the bloodstream and become available to tissues throughout the body. Eggs may be particularly useful for someone who has little appetite in the morning or finds large servings of meat difficult to eat. For example, breakfast could include eggs with vegetables and whole grain toast. If one egg does not provide enough food for your needs, combine it with yogurt, milk, beans, or another suitable protein source. Before we continue, remember this. One protein-rich dinner may not compensate for breakfast and lunch containing almost no protein. Spreading protein-containing foods across breakfast, lunch, and dinner may be more practical than saving everything for the evening. However, personal protein needs vary. Body size, activity, total calorie intake, kidney function, illness, and recovery needs all matter. Anyone with chronic kidney disease should follow individualized medical and nutritional guidance rather than automatically increasing protein. Food number 2 is plain Greek yogurt, or another suitable high-protein dairy food. Greek yogurt can provide protein and calcium. Some varieties also contain vitamin D. Calcium supports healthy bones and participates in normal muscle contraction. Vitamin D supports bone health. Inadequate vitamin D can sometimes contribute to muscle weakness or discomfort. But check the nutrition label carefully. Yogurts can differ greatly in their protein, added sugar, fat, calcium, and vitamin D content. Choose a product that fits your nutritional and medical needs. If you cannot tolerate lactose, consider lactose-free dairy. If you avoid dairy, a fortified soy alternative may be useful. However, plant-based products are not all nutritionally identical. Compare the protein, calcium, vitamin D, sodium, and added sugar shown on the label. A simple snack could include plain Greek yogurt, berries, and a small amount of chopped nuts. Notice what this snack does not contain. It does not require a mysterious muscle-building powder. It does not use an extreme dose, and it does not promise overnight strength. It is simply a useful combination of protein, energy, and micronutrients. Here is a question many people overlook. Are your muscles receiving enough nutrition, or are you unintentionally eating too little? Some older adults lose their appetite, skip meals, or avoid so many foods that their total calorie intake becomes inadequate. When your body consistently receives too little energy, it may use some dietary protein for energy instead of reserving it for maintenance and repair. Eating sufficient food is therefore part of protecting muscle. Food number 3 is salmon, or another suitable fish. Salmon provides protein, vitamin B12, and naturally occurring vitamin D. Fatty fish are among the better natural food sources of vitamin D. Vitamin B12 helps support healthy blood cells and normal nerve function. A deficiency can sometimes contribute to fatigue, numbness, balance difficulties, or weakness. But these symptoms can have many different causes. They should not be self-diagnosed from a video. A practical meal could include baked salmon with vegetables and potatoes. You could also add canned salmon to a salad. If fresh salmon is too expensive, alternatives may include canned tuna, trout, sardines, or another available fish. Canned sardines and salmon with edible soft bones can also provide calcium. Choose lower sodium products when possible, particularly if you have high blood pressure, heart disease, kidney disease, or a prescribed sodium restriction. Remember that more is not always better. Extremely large fish portions are unnecessary. Eating a variety of suitable foods helps you avoid depending too heavily on one option. Food number 4 is inexpensive, filling, and frequently overlooked. It is the group that includes beans, peas, and lentils. These foods provide plant protein, carbohydrates, fiber, iron, potassium, magnesium, and other useful nutrients. Carbohydrates are not automatically the enemy of muscle. They provide energy for movement and exercise. If you do not have enough energy to exercise or stay active, it becomes harder to challenge your muscles consistently. Imagine 2 lunches. The first contains only tea and a few crackers. The second contains lentil soup, vegetables, and whole grain bread. The second meal generally provides a more useful combination of protein, energy, fiber, and micronutrients. Plant proteins can support a healthy diet. However, an individual serving may provide a different amount and balance of amino acids than dairy, eggs, meat, or fish. Eating varied protein foods across the day can help create a balanced pattern. If canned beans are more convenient, choose low-sodium or no-salt added options when available. Draining and rinsing regular canned beans can also remove some sodium. People with kidney disease may need personalized advice about protein, potassium, phosphorus, sodium, and portion size. Do not completely eliminate nutritious foods or dramatically increase them based only on a general internet list. Let us take a quick recap. Eggs offer convenient, high-quality protein. Greek yogurt can provide protein and calcium. Fish provides protein and nutrients such as vitamin B12. Fatty fish can also provide vitamin D. Beans and lentils combine plant protein with useful energy and fiber. But the next 2 foods make this plan more flexible for both meat eaters and people following plant-based diets. Food number 5 is lean poultry, such as chicken or turkey. Lean poultry is a concentrated source of protein. It can help you build a balanced meal around vegetables, whole grains, beans, or another carbohydrate source. The preparation method matters. Fresh grilled chicken is different from heavily processed chicken products that may contain substantial sodium and saturated fat. You might add shredded chicken to vegetable soup. You could serve grilled chicken with brown rice. Or you could combine turkey with beans and salad. The goal is not to eat enormous portions. The goal is to build balanced meals that you can repeat consistently. If chewing is difficult, softer options may be easier. Examples include minced chicken, slow-cooked poultry, moist fish, yogurt, eggs, tofu, and lentil soup. New chewing or swallowing difficulty should be discussed with a healthcare professional. It can reduce food intake and may create safety risks. Now consider this question. Which builds more muscle? Adding another chicken breast to your plate, or performing an appropriate strength exercise? The exercise supplies the training signal. The meal supports recovery. Extra food without movement does not automatically become functional muscle. Food number 6 is soy. Useful soy foods include tofu, tempeh, edamame, and fortified soy milk. Soy foods provide plant protein. They can make muscle-supportive meals more accessible for people who do not eat meat or dairy. Tofu can be added to stir-fries, soups, and curries. Edamame can be served as part of a meal. Fortified soy milk can be used with oats or cereal. Check the label for protein, calcium, vitamin D, sodium, and added sugar. Do not assume that every plant beverage can nutritionally replace dairy. Almond, oat, rice, coconut, and soy beverages may contain very different amounts of protein and added nutrients. Choose the product based on its nutrition label and your health needs, rather than relying only on the picture on the front. Those are the 6 food groups: eggs, Greek yogurt or another suitable dairy food, salmon or another suitable fish, beans and lentils, lean poultry, and soy foods. You do not need to eat all 6 in one day. You also do not need animal foods if you follow a carefully planned plant-based diet. The bigger goal is to consume sufficient overall energy, include varied protein foods, and obtain the vitamins and minerals your body needs. Now we reach the part that many food videos leave out. Food cannot explain or correct every case of leg weakness. Possible contributors include inactivity, medication effects, anemia, vitamin B12 deficiency, vitamin D deficiency, thyroid problems, infections, joint disease, nerve conditions, circulation problems, heart or lung disease, diabetes complications, and other medical conditions. This list is not provided for self-diagnosis. It explains why persistent, unexplained, or worsening weakness deserves professional assessment. Ask yourself whether the change is gradual and affects both sides, or whether it began suddenly and affected one side. Sudden weakness on one side of the body can be a stroke warning sign. This is especially concerning when it occurs with facial drooping, difficulty speaking, confusion, severe dizziness, vision changes, or a sudden severe headache. Seek emergency medical assistance immediately. Also seek urgent medical care for sudden leg weakness, accompanied by severe back pain, new loss of bladder or bowel control, numbness around the groin, chest pain, severe breathing difficulty, fainting, or an inability to stand. Do not wait for a food, supplement, or home remedy to solve an emergency symptom. Now let us turn this information into a realistic action plan. First, what can you do today? Look at your 3 main meals. Identify whether each meal contains a useful source of protein. You might have eggs or yogurt at breakfast. You might choose lentils or chicken at lunch. Dinner could include fish or tofu. Add vegetables, fruit, whole grains, or another appropriate source of energy according to your individual needs. Muscle health depends on the complete diet, not protein alone. Next, include safe muscle strengthening activity. General public health guidance recommends muscle strengthening activity on at least 2 days each week. Older adults should also include suitable aerobic and balance activities when possible. A beginner might practice standing from a stable chair. Other options may include wall push-ups, supported heel raises, or appropriate resistance band exercises. Use a stable surface. Begin within your current ability. Move slowly and maintain control. If you have significant weakness, poor balance, recent surgery, chest symptoms, uncontrolled medical problems, or repeated falls, speak with a healthcare professional or physical therapist before starting. The objective is gradual progression. The objective is not exhaustion, severe soreness, or pain. What should you monitor? Notice changes in your walking speed, balance, fatigue, appetite, body weight, falls, and ability to rise from a chair. Unintentional weight loss should be evaluated. Rapidly declining strength should be evaluated. Repeated falls, persistent numbness, or increasing difficulty with daily activities should also be discussed with a healthcare professional. What should you ask a healthcare professional about? Ask whether any of your medications could affect balance, alertness, blood pressure, or strength. Ask whether your symptoms suggest a need to evaluate vitamin B12, vitamin D, anemia, thyroid function, nerve health, circulation, or another possible cause. Ask whether a registered dietitian could help if you have kidney disease, diabetes, digestive problems, food allergies, limited appetite, or difficulty maintaining your weight. What should you avoid? Avoid extreme diets that remove entire food groups without a clear medical reason. Avoid dramatically increasing protein without considering your kidney function and total nutritional needs. Avoid relying on supplements as replacements for food, movement, sleep, and medical evaluation. Vitamin D or vitamin B12 supplements may be appropriate for some people. However, that decision should be based on personal risk, diet, test results when indicated, and professional guidance. Avoid comparing your physical progress with someone 20 years younger. A more useful comparison is your own function over time. Can you perform one more controlled chair stand? Can you walk slightly farther without excessive fatigue? Can you climb stairs with greater confidence? Functional progress is more meaningful than chasing an unrealistic appearance. Let us summarize the most important points. Leg weakness may become noticeable after 60, but it should not automatically be dismissed as normal aging. Eggs, Greek yogurt, fish, beans, and lentils, lean poultry, and soy foods can provide protein and other nutrients that support healthy muscles. Vitamin D, calcium, vitamin B12, iron, sufficient calories, hydration, and a varied diet may also matter. But no food strengthens your legs instantly. Muscles need an appropriate training signal. They need sufficient recovery, and they need time. Persistent or worsening weakness may have a medical cause that food cannot correct by itself. If you found this explanation useful, subscribe to Dr. Maxwell Orvane for more clear and practical health education. In the comments, tell us which option is easiest for you to add to your meals: eggs, yogurt, fish, lentils, chicken, or tofu. Share this video with someone who wants to protect their mobility and independence. And remember, this content is provided for general education. It does not replace medical advice, diagnosis, or treatment from a qualified healthcare professional.